Okay. Hey, everybody. I'm so excited to introduce you to Dr. Jessica Zucker. If you don't know her, she's a psychologist who practices in the Los Angeles area. And she's also the author of I Had a Miscarriage, which she has with her. Oh yeah, perfect. Which I have given to so many people, especially during it came out in March, and during COVID, I think I had maybe 4 or 5 people who were really close to me have miscarriages. And it was kind of the first time I think I had really focused on like fertility issues and how painful and joyous they can be. And so her book really got us all through it. So welcome, Jessica.
Thank you so much for having me.
Can you talk just really briefly about who you are and why you wrote the book?
Yes, of course. So I'm a psychologist and I specialize in women's reproductive and maternal mental health, and have done so for over a decade at this point. And then 16 weeks into my second pregnancy, I had a miscarriage while I was home by myself. I was instructed by my doctor to cut the umbilical cord. I promptly began to hemorrhage. So suffice it to say, this sort of like long and intense road of losing this pregnancy changed my professional and my personal sort of life trajectory. So I had already specialized in this, but I hadn't gone through anything firsthand until I did. And so soon after time I felt like was not on my side in terms of my age and everything. So we decided to try to conceive again rather quickly. I have a lot of feelings about that, and they're included in the book. I mean, it was really difficult to not sort of have time to fall apart and to grieve the way I wish I could have. And yet I felt like it was sort of now or never if we wanted to try again. And so I delve into the book about, my own mental health struggles once my healthy daughter was born subsequently. So the book and all my writing sort of takes on the complexity, the spectrum of it that results from having a loss. So what does life after loss look like and feel like? How does it affect our sex lives? How does it affect our body image? How does it affect our work lives? And the way we parent, the way we live. And so I take it all on in the book.
How do you kind of want people, what's your end goal if there is one? Because I know that's sort of a complicated question. How do you want people to feel after reading it or experiencing your story?
I mean, not to sound cliche, but I truly just want people to feel less alone. I think like we say oftentimes, you're not alone, you're not alone, you're not alone. But sometimes it takes reading words like these or hearing other people's stories to actually feel like you're not alone and to really believe that, miscarriages occur, 1 in 4 pregnancies result in miscarriage. So we're not alone. But for whatever reason, because we're so quiet about this pain, people, suffer in silence. And I really hope that the book sort of provides a depth and a richness and the capacity to hold people through this.
I do think that that's something pretty phenomenal about the book, how it addresses grief in sort of a whole sense and not just, I found it really useful and incredibly interesting, just as I haven't experienced personally a miscarriage, but also try to how to figure out how to support the people who are closest to me. And I have 2 really quick questions for you, and then I'm going to have you share your secret. But one, could you briefly talk about sort of silence and sort of the 3 sort of emotions that come up when we don't kind of talk about our feelings or after having a miscarriage?
Sure. So the trifecta that I talk about in my book and other places is the silence, the stigma, and the shame. So the cultural silence that surrounds this topic is ubiquitous, and that's sort of, my hope and my passion is to kind of to make a dent in that somehow. And I believe, though, that the silence leads to stigma. And then the stigma results in shame. And the swirling of these things really, keeps people suspended, I think, in their grief. If we were allowed to kind of lean into it, express it, be vulnerable about our grief, I think the pain would ease a bit sooner or feel softer. And because we live in a world that's kind of so afraid of pain and afraid to talk openly about loss, we sort of stay in it longer and we feel more alone. And I think people bog down in it when they're suspended in it.
Mhm. Can you briefly talk a little bit? I think you talk about this in the book about trying to figure that there's no sort of one size fits all way to heal. And
Yeah.
how sometimes you recommend to your patients different routes or different ways than you would actually need for yourself. And I think that recognition
Yeah.
is important. How do you kind of assess the situation and figure out kind of how to kind of be, I hate to use this word effective,
Mhm.
but helpful?
Yeah, that's such an important question. Thank you. Yeah. Yeah, I think like if we steer clear of the mainstream platitudes and with ourselves and other people, and also if we kind of give up this idea that there has to be a silver lining, we don't have to find meaning in our pain in order to live through it or move through it, and this is what you were discussing earlier, it's like, wow, my pain has taught me such and such. We don't need to learn the lessons if there are any. There may not be any. And so I think that when I'm working with someone, it's really sort of about how do they feel about their loss? Because when we project what we might feel onto other people, we just don't serve them or ourselves. And so, true empathy is really asking somebody, where are you? How does this feel for you? And then as a therapist, I meet them there and try to simply, honestly be present with their pain. I never try to sort of hurry them up or convince them otherwise, because as we know, that's just completely unhelpful.
I think about silver linings a lot, and my sort of, I really want to find them, but I also have a really complicated relationship with them because I don't, they don't have to exist. And I feel like there is a shift happening because I would say like a few years ago, maybe 10 years ago, silver linings were like, that's what you did. You looked for them. And maybe I'm just like a little bit behind the curve, but I feel like now it's very much like shit happens, doesn't have to mean anything.
Yeah.
And we don't have to learn from it. But we can keep going.
Exactly.
So I'm going to have you share your secret
Yes.
with us today. Thank you. And thank you so much for being open to doing this with me.
Of course. Thank you so much for having me. So I wanted to share something about myself, what I'm going through now. 2 weeks after the book came out, I learned that I had breast cancer. And it was interesting because the very things that I say to my patients and in my writing in the book about what we should not say to people when they have a pregnancy loss. So most importantly, sentences that begin with the word at least or the phrase at least, I ended up doing to myself. So upon learning that the cancer had not spread to my lymph nodes, I found out that I would not have to undergo chemotherapy, but instead radiation. And I found myself walking around saying, well, at least it's not chemotherapy. I can do anything because it's not that. I had no idea how much I was actually actively minimizing the intensity of what I was about to go through. And radiation kicked my ass, like beyond, in all sorts of ways, the side effects, but also emotionally, driving there 5 days a week for 5 weeks, laying there, being the patient, being in the gown, all of it. And so anyway, all of this to say, that my secret is I even turned the at least on myself. And it was a really important eye-opening moment for me to see how I was actively, minimizing what I was going through without knowing it.
Well, there's so many things to sort of dig in there. I'm curious. The first question that came to my mind was in terms of minimizing. Why is it not helpful to minimize? Because I feel like throughout my life, at least, I've had people like it's a coping skill. Some people use it as a coping skill, but why isn't it helpful?
Because it doesn't accurately reflect what we live through. And so I think it's most often used by our loved ones to say, oh, well, at least your daughter is alive, or at least you got to become a mother. And a lot of people don't. But and the truth of the matter is, why can't we live in the complexity, the nuance, that middle place of, yes, it's wonderful to be a mother, and it's very painful to be the kind of mother that you are. And same with this. Yes, I'm very relieved I didn't have to go through chemotherapy. It's still incredibly intense that I have breast cancer and that I was undergoing radiation. And so can we hold all of these pieces without trying to make them smaller? Because trying to make them smaller does not actually make them smaller. It just makes us feel less seen, less understood. And then, as I was saying, then we do it to ourselves.
It's really hard to kick the habit of doing it to yourself. It's crazy how that thought, or what you had just said, had rung through my mind so many times. At least I have a baby.
Yeah.
She may not be healthy, but that's so much more than other people have. And again, comparing my pain or my grief to other people, my expectations about what other people are going through. Like the other thing I wanted to kind of touch upon was that I feel like I have a propensity to really want to seek truth and find meaning. And this practice of sort of accepting multiple truths and the complexity is really difficult and also really unsettling and ungrounding.
Really.
Do you have ways that you can kind of gently remind yourself where you're at and get comfortable with the uncertainty of it all?
Wow, that's a beautiful way to put it, and an important question. I don't have a perfect answer, except I do think mindfulness and meditation can really help with this. Sometimes, though, sitting in silence and being with the breath can be unsettling because there's so many thoughts and so much intensity. And so I think connecting with someone who you truly trust, who truly gets you, who's not going to try to fix or change or do anything, can allow us to hold the multiple truths, like you're saying. And, we don't have to tidy things up. I mean, this world is messy, and so are our inner worlds, right? And that's okay. And we just have to somehow learn to be okay with this and not find reasons for everything. It's like a lot of people want so badly to understand why they had a pregnancy loss, even if they can't get an answer. And I felt that way initially when I got my breast cancer diagnosis. It was just like, wait, what did I do? What did I not do? And I think women are taught, girls and women are taught from the get-go to kind of blame ourselves, look for reasons within ourselves. And so often that's just not the case. And it's super unhelpful and self-sabotaging, really.
Well, thank you so much. I realized a moment ago I had asked you for tips or for ways that you kind of figured out how to support people and their differing needs. And then I was like, can I have a one size fits all answer about how to feel better? So,
it's just meeting people where they are and really trying to let them know that, these difficult feelings, the challenges don't last forever. Especially the most intense feelings, and but remembering that and being present through that can be excruciating.
What's your theory on why they feel like they're never going to end?
Well, I mean, depression, anxiety can really play tricks with our minds. And so I do think sometimes that's, what can lead to feelings of, suicidal thoughts and feelings. It's just thinking like the black and whiteness of it, it's all or nothing. It feels like it's going to last forever. The feelings really dig in. And yet by the next day, maybe with some fresh air, some exercise, a wonderful conversation, a bath, who knows, we feel a shift, even if it's super subtle. And sometimes we don't, but often we do. And so that's, a real reason to not make huge decisions when we're feeling at our worst.
Well, thank you so much, Jessica, for coming here. Can you show us your book one last time?
Oh, sure, of course. Thank you.
I'll have the information for everybody if you want to check out the book. You do want to check it out because it's amazing.
Thank you so much.
I'm hoping you're doing better and on the mend, and potentially I'll get to talk to you again soon. But thank you so much for doing this, and thank you for sharing your story in hopes that other people will feel less alone. As sort of cliche, not to use your word cliche as that sounds, I really believe in it.
Thank you so much. Thank you.
Care.
I believe in you and yours too. Thank you.
Bye.
Bye.